Yes, welcome my people to the channel. Welcome to this channel, Benjamin the Wise Guy. This channel is talking about medical issues, medical complications, and issues concerning health. And as usual, as we do, we welcome people always. We tell people what we do, and we continue with the talks. So if anyone is here as a new person, as any person that is new and is likes medical talks, interested in health issues, log in the platform, talk to us, let us know where you are from, I'm saying us because we are a big team. When we meet, we talk about several issues. So guys, you are welcome to the platform. And if always, even if you have a question you would like to ask, you are it's okay that you ask, so that we can connect and relate. So if you are new to the channel, we welcome you here. I do personally welcome you to this channel. And what we usually do is after we welcome people, we relate and we know what we. If you're a new guy, tell me where you're from. If you are a new guy, tell me where you're from. This is if you are a new guy, tell me where you are from. I'm just logging in. Today's topic is continuing, and the continuing topic is bipolar disorders. Today we will be classifying bipolar disorders. We will be doing classification of bipolar disorders. So anyone who is reaching in as I organize notes, everything, tell me where you are from, tell me where you are chilling at, tell me where you are, so that we can connect and see how we do things in here. My name is Benjamin the Wise Guy. Everyone in the chat, let's connect. Let's connect and see. Bipolar disorders. Many people say that. Some people confess they are bipolar. Some people say that they have been diagnosed. Yesterday we saw classification. This is a thing that is, the real cause is still under hypothesis. And when the real cause is still under hypothesis, what we usually do is we try and find out through research. We have seen several things that people undergo, and we have seen some conditions that share the same problem with this condition. We have seen some conditions that share the same thing with bipolar, but we just mentioned something about bipolar yesterday. We introduced bipolar yesterday, and we saw the introductory part. It is characterized by mania, hypomania, and depression. Or you can have both. But today we are characterizing classification upon all this. So as you come in, let's talk about what you understand about bipolar. Bipolar classification. As you come in, let's see where you are from. Let's see where you are chilling at. Let's see where you are. The topic is still bipolar. This is a week that we'll talk about bipolar. Although from tomorrow we can have some changes. I might come in late tomorrow, and on Thursday I might have problems of coming in, but we will see what to do we will see what to do. So my guys, those who are tuning in, those who are tuning into the platform, welcome more in the channel. It's a big time as I organize these notes. Let me see. Yes. Let me see. Yes, but sometimes when it's not because the topic of the day is bipolar, so we restrict ourselves on bipolar. Ask any question that you feel is important. Any question that you feel is medical and is important. You can always ask the question, so that at times we do what? So that at times we help, keep on helping people about their problems. But we always help when you ask. So if you don't ask, it will be a problem to know what you need. But if you're coming in, tell us on the chat where you're from. Tell us in the chat where you're from and where you are chilling from. Where are you from and where you are chilling from. So it is I've said it's a week of bipolar. We have been discussing bipolar disorders, and some weaknesses are more of cognitive complication rather than degenerative and or developmental. Something like bipolar disorder, something like bipolar, that one is neurogenetic, that is not understood. That is even doctors are still researching, but most of them say that bipolar is genetic. Most of them say that bipolar is genetic. You carry it from co-parents. But let's see the classification. Yesterday we brought the topic up and we categorized it. We categorized it into several bipolar. We categorized bipolar into mood-related disorders, show mania, hypomania, depressive disorders. You see, it's like in ADHD we talked about interactive, and we talked about impulsive, but in bipolar we are talking about mania and hypomania. So let's not confuse about ADHD and bipolar. They are two different things, and these things are always kind of like same, because people that are categorized with ADHD, you may like categorize them the same as with the same kind, like the same like bipolar, you see. So you may, as we continue, this is Queen Blessings, Dr. Benjamin, watching you at work again. Yes, I'm at work. Just logged in to continue with the topic of the day. And the topic of the day is bipolar disorders. So I was kind of like relating between bipolar disorder and ADHD. So they kind of look the same. You may confuse bipolar disorder with ADHD. Attention deficit is where we are talking about inattention, hyperactivity, and impulsivity. But when it comes to bipolar we are talking about several factors like impulsivity. Bree Johan, hi. I can see you are here. No, I'm working now. while watching you. Oh, okay, nice. Cool. That is fine. Bree Johan is a new one. Welcome to this channel, Bree Johan. Which side are you coming from, Bree? Bree Johan, which state are you coming from? It's good to have an introduction before I start classifying. You know, we are classifying bipolar disorder. So let's welcome the people that are coming in as we wait to start classification. So Brit Johan, Zimbabwe. Zimbabwe is a good country, a country with a good landscape. Country with a good landscape. Welcome. Here we talk about medical issues. That's why you are hearing me talking about bipolar disorder. Yesterday we did bipolar, we introduced, and now we are classifying today. So Bree, feel free to chat with the people at the chat and give a like. Don't forget to like the chat, and also subscription, so that when we are live, you are receiving your notifications in time. And if you have a medical question or any question that you may feel is of importance, you can ask at the chat, and we relate with the people that are at the chat. You know, when you like video, it creates impression. And if you have a Kingray, I can see Kingray. Welcome. If you have a channel, Bree, please tell the people at the chat, so that they can even boost you. They can even boost you. I have been to Zimbabwe. Love it. Yes, Zimbabwe is a land. It's a scenic land. It has good scenes. Very nice. Very nice. Okay. Now we are discussing about bipolar, and today we want to classify bipolar. I was saying about confusion of ADHD and bipolar. You see the confusion. Sometimes people confuse both of them. You will see that in ADHD, attention deficit, you have attention hyperactive and impulsivity. But when it comes to bipolar has mania, depression, and hypomania. You see, so those two things are commonly confused. You don't confuse bipolar with ADHD. Mania means very high energy, reduced need for sleep, taking very fast, reduced thoughts, increased confidence, and curiosity. So it is the opposite. When you are thinking, you have reduced thinking, but your actions are so fast. That is very risky. It is reckless, and sometimes these people that are diagnosed with this complication, they are not allowed to get driving license, because they have problems. Greetings to you, Dr. Benjamin, and welcome everyone in the chat. Jamaican uncle, welcome to the chat. Welcome to the chat. Now, people that have hypomania have depression. They always have depression because they don't understand at times what is causing their issue. You see, ADHD, you get. Let's talk about Margie today. You are here. Welcome, Margie, to the chat. Welcome to the chat. And I've said, if you are a new person, please leave your like, subscribe, interact with the people that are in the group. Interact with the people that are in the group. And if you have a channel, tell us you have a channel, so that we can see the good work that you are doing. Because we always follow good work. Now, today is a great day. We want to categorize bipolar disorders. Bipolar disorders. I was just giving an introduction of some things that you need to check when you are doing a diagnosis, or you are thinking of a diagnosis. So attention deficit, we have said it is having no interest, no thinking, and issues concerning impulse, thinking before action, inattention, hyperactivity, and impulsivity. But bipolar is mania, hypomania, and depression. Mania, hypomania, and depression. It's very nice to categorize this so that a person would know how to categorize the problems. Hypomania, mania, and depression. Mania, doing things without reasoning, impulse. Mania is high energy, people with high energy, you get. So that is bipolar, and today we are doing the categorizations. So if you have any question concerning anything, any question that you understand and you know it's something that you would like us to talk about or to expound on it, just ask so that we go slowly by slowly. We will deal with categorizing this that is called bipolar disorder, and we will start it as categories. The bipolar has categories, and category 1 is bipolar disorder 1, bipolar 2 disorder, and we have another one which is called cyclothymic disorder. Let's talk about bipolar 1 disorder. Let's talk about bipolar 1. We see what is bipolar 1, because some people say bipolar is just bipolar. No, let's see bipolar 1 in details. And we've said a person who is bipolar has a problem with high energy or low energy and gets to depression. Every time you hear about bipolar, think of something that is called mania, either hypo or hyper. Hypo is low mania, hyper is high mania. That means you can either have high energy and low energy. Sometimes you don't have interest, you see. So those are the things that we think of. Blessings to you, Majay Mayadi from Yada. A big term is that, uncle. I am a Yadi from Yada. You see that, Majay. Big time. Shout out from uncle. Your Yadi from the Yada. Tournament Yada is out at Kingston, Jamaica. Hello, Daktari. Good to see you. Simple Kate. Yeah. Welcome, Simple Kate. Nice to see you too. Doing good, and you know, you also, I know you are doing good daily. If I see you in the channel, I know everything is fine. So let's see the new people that are coming in. Where are you from? Where are you watching us from? Where are you interacting with me from? If you are interacting me away in the US, in Australia, Asia, and Philippines, you understand, Greens, UK, all those places, tell us, come and tell us hello to the chat. Tell us, don't forget to like, and also your subscription is important, man. Your subscription is important. Don't leave without saying get that subscription. I want to be following you. I want to be following Benjamin the Wise Guy, man. If you're coming in, today's topic is bipolar disorder classification. And what do you understand by bipolar disorder? What do you understand by bipolar disorder? Tell us how you understand about bipolar disorder. Anyone who is coming in new, please tell us what you understand by bipolar. But remember, today is classification. Don't fail to hit the like button, my friends. Hit the like button. Just like it gives us an impression, gives us an impression. So bipolar 1 disorder is severe mood disorder characterized by at least one manic episode. Ivano Baga, weni bipolar nimesikia ama Ivano, mimi si bipolar. I'm a doctor. I'm discussing about bipolar. Ivano, you last time you went Ivano, we are talking about bipolar. We are not bipolar, we are discussing about bipolar so that we can help people that are bipolar and people that are living around people that are bipolar. So Ivano, welcome to the platform. I know you are from Kenya. Your text clarifies that is Swahili. So Ivano, welcome. Which place in Nairobi do you live, or which place in Kenya do you live? Ivano, you from Nairobi, right? Okay. Now, welcome everyone. Don't fail to give the like. Let's get those impressions rolling and coming in. Let's get those impressions coming and rolling in. I wanna know where Ivanobaga 7497, where he's coming from. Where? Colding Slice. Remember to like and subscribe. Colding _ Slice. Let's slice him with subscription, Colding. Welcome, Colding. Welcome to the platform, and your subscription and likes are granted. Access granted to the chat. Drop them text to the chat. Let's converse. If you are a new person here, please. Interaction is great. It's great. Before I continue, I can see some new people watching. Slide your DM out of the chat there. Say this one coming out here. I'm coming from the US. I'm in Nairobi. I'm here and there. So let's know. Let me get to know you. Let us get to know you, the new people. So the topic of today is classification of bipolar disorders, and by classification we categorize and we see how we do it. You remember how we talked about yesterday? If you have an experience on bipolar disorders, please hit the chat. Tell us the experience. Even if you are new, the chat is open. Drop your chat on the link. Tell us where you are from. Tell us where you are watching me from. Coffee Cakes in the house. Welcome the Coffee Cakes, my darling queen. Coffee Cakes. Welcome. Thanks for tuning in. Thanks for texting and listening to Benjamin the Wise Guy. You see, Simple Kate has already come in. Marjay B. Efasi Lipenga. We have seen a Jamaican Uncle Judy. All of you that are watching, be blessed, and always thanks to Almighty for what you're doing and what He's giving us is life. So let's talk about the first bipolar disorder. The first bipolar disorder. What is bipolar disorder 1? Bipolar disorder. Some people call them psych, but let's see if these people are psych. Let's see if real these people are psych here. You see, bipolar disorder 1 is severe disorder characterized by at least one maniac episode. One maniac episode means El Marie Smith. Hey, Marie. El Marie. You know, my last born is called El Marie. So when you come in, I remember my last born at home. She's still a baby. Welcome, El Marie. Marjay B. If a person always lie and don't like when someone is happy, they get sad and even cry. Is it bipolar? No, that is not bipolar. I'll speak about that complication before we. Now, our Psych 88, Jesus is coming. Yes, I wish we see him today. Jesus is coming, Ezekiel 38 and Zechariah 14. The earthquake in Israel is coming. The Mount of Olives will break wide open. Psychs 88. You dropped us a message yesterday. Today you have another verse. That is cool. It's like you are telling people, please repent and come back to Jesus. Sykes, blessed up, my guy. Subscribe and like, and let's continue telling people about the gospel of Christ. Sykes. I like that. El Marie, big up yourself. I've not seen you for some time. And what's up, El Marie? Everything okay? Talk to doctor. Everything okay? You know, when I've not seen 1-2 people in some time, I start wondering what is happening. Is everything okay? So let's pray for each other for better health, and let's take care of our health every time, my friends. You know, it's very important when we are blessing up everyone and taking care of our health. So today We're classifying bipolar. So bipolar 1 disorder is classified by one episode of mania. Mania, aggressiveness, and having that mania is a real aggressiveness. Yes, you have seen a bipolar person being totally aggressive, not wanting to talk to someone and bringing chaos around where he is or she is. Episodes of depression come after the aggressiveness. J Hank, hi fam. J Hank, my guy, out of Thika. I don't know where J Hank in Thika you are. J Hank, do you stay in Thika town, Makongeni, section 9? I know those areas. Pilot, I know those areas, Jayang. I know Pilot, I know Makongeni, I know section 9, I know Crevasse, all those places, section 2. So Jayang, where do you come from? Could that not be if only one time, temporary insanity? It can be one time in a period of like a month or 3 months. Temporal insanity. Yes, temporal insanity can be there, or aggressiveness because of agitation. But let's see, we are still categorizing coffee cakes. Coffee cakes, what's your real name? Please give me your real name. Episodes of depression commonly occurs as well, although depression is not required for diagnosis. Greetings, doc. I stay in Makongeni near police station. Hey, J Hank, I know those places. I've been there in and out, and for some time. I've stayed in Thika for like a year or 2. Yeah, that is some times ago. And the illness causes abnormal shifts in mood, energy, activity, sleep, judgment, and thinking of behavior. You see what they do? They shift in mood, energy, activity, sleep, judgment, thinking, and behavior also. It belongs to the group of mood disorders. So this one is not a bipolar is not a neurodevelopment. You see? This is not a neurodevelopment. You see, it is not a neurodevelopment. It is a condition characterized by mood disorder. So my friend, sometimes when you are seeing a person who is aggressive, this might confuse you with bipolar disorder. And the confusion may bring what? Problems. Why? Because just a minute. If you have any question about bipolar 1, you ask. I think there are some similarities between bipolar person and one with a narcissist and bipolar. They are different. Just let me you see, a narcissist is different from bipolar disorder. Narcissists are different from bipolar disorder. You see, because what they do, they are selfish. let's not talk about nurses. Let's categorize this first. Now, thinking and behavior. It belongs to mood disorders. Core features when it comes to mania. A manic episode is a hallmark of bipolar disorder. 1. Manic episode. Those people that are very aggressive, they want to shout, but you know that there is aggression and mania. Aggression means when someone has agitated you and then you hit back. That is not mania. But this is a person just abruptly starts to be manic and disrupting everything. And high energy levels. When you pin this down, he is fighting all people around. You see, a manic episode is a hallmark of bipolar 1. And diagnostic features of mania, we are going slowly. If you have any question or attribute or you can add, please add. Abnormal elevation, expansive or irritable mood, increased energy or activity. But you see, when it is increased energy or activity, this is categorizing mania. It should be at least on 1 week. 1 week of duration, or any duration in hospitalized is needed, or any duration if hospitalization is needed. 1 week of one period of mania, then we categorize you as bipolar 1. During mania, at least 4 of the following. During your aggressionness, high energy levels and disruptions that you have, inflated self-esteem or grandiosity. You get decreased need to sleep. You don't have sleep. Increased talking, pressured speech. Increased talking and pressured speech. Racing thoughts and distractibility. You are thinking, your brain is working 100 kilometers per hour. Fast. Increased goal directly activity, agitation, risk-taking behaviors. You are doing some things that are risk-taking. Let's say, like example of reckless driving, excessive spending. Even spending impulsively might be mania. You see, some people can spend, sometimes those people that go to shopping, and then you spend your money, you spend everything, you buy things that are unnecessary, you do things without thinking. You do things without thinking. It is very sad when you find such people. Some people are bipolar and they don't know how to spend. And then you tell people of unrealistic business plans that you know you cannot handle. Bipolar. It's very confusing and very hard to handle. You get. Now, how does manic episode come? How do you get manic episodes? Extremely happy and euphoric. Overconfidence, irritable or aggressive. You see, overconfidence and you are always irritable and aggressive. This is now mania itself. I knew a man who was bipolar. He would buy a new truck every week. Yes. And excessively buying, spending on clothes. And others, you can see that they are just buying on clothes and fashion, shoes. Bipolar. But in 1 week, you find that this person is totally aggressive. You get? This person is totally aggressive. Irritable or aggressive. Disturbance of sleep between 1 to 3 hours and still feel energetic. These people may only sleep even 1 hour and they are still energetic. Very energetic. You see, thought disturbance. Rapid, disorganized thoughts and difficult to follow. You give instructions to these people and they are difficult to follow. They want to do whatever they want to do. You get? Speech changes. Speech changes, loud, fast, continuously difficult to interrupt. Speech changes. Behavioral changes. Patients may start new projects without finishing the old ones. Spend large amounts of money. This is very sad. Some people even become hypersexual. Want to sleep with everyone that they think is beautiful or handsome. Making impulse decision. You see now, this one is not like a person who is aggressive because of being agitated. This is something that has taken time. You see, this is something that has taken time. And you may find that there is some psychosis that can come in. There are some psychosis that can come in bipolar. Severe mania leads to delusions and hallucinations. You see, this is bipolar 1, but you start having hallucinations, believing they are chosen by God, believing they have special powers, and hearing voices. You start hearing voices. Bipolar that has come into psychosis. After you have episodes of mania, you start hearing voices telling people you are chosen by God. And then after that, when you sit down, people feel that you are depressed. You start having depression. Very cool, kind, and you want to sit alone. You see the kind how they go. Hypomania. No, you see that. It is very important to categorize these things because you will come to know that this one is bipolar, this is a normal person, this is ADHD, attention deficit. In attention, ADHD we have said inattention, impulsivity. You see, ADHD, that's where we talk about inattention and impulsivity. And sometimes some people have been misdiagnosed by some doctors and they are given some drugs that they don't need. You find someone as ADHD has been given antipsychotics. If you give antipsychotic to a person who has bipolar, it will kind like work because this person is hallucinating. So it will drop the hyperactivity of dopamine. So the hallucinations will go down. You see, that is in bipolar. But if you give antipsychotic to a person who has ADHD, it may not work. It may increase the problem. Inattention, hyperactive, and impulsivity. So when you are giving this person something that is antipsychotic, it may bring problems. You see how we categorize them. Now let's talk about, that is bipolar 1. Then we go to bipolar 2. Bipolar 2. How is bipolar 2 categorized? How is bipolar 2 categorized? How is bipolar 2 categorized? Bipolar 2 is the upgrade of 1. Now here is where we get several complications plus some more depression. You see, the first one was at least a week's time. At least a person who has depression in a week's time, and the hyperactivity of mania, 1 episode, and the actions are continued. Because if you have 1 episode of mania activity, but you are doing like the things I've said, you are buying and impulsively spending continuously, you see that thing has not come out, you still have it. So we may reduce by cognitive behavior therapy. Bipolar 2 definition is bipolar 2 is a mood. It's still a mood disorder characterized by at least one of hypomanic hypo. The mood is the hyperness, the high hyperness is down, at least one depressive episode. and no history of full manic episodes. Now this one is the reverse. This one is reverse. This one is reverse. This one is reverse. In this way, the first one, we saw one episode of hypermania, aggressiveness, but in 2 we are seeing hypo, lowness and depression, and no history of full mania episode. You are very down. You are at least one major depressive sign. You are showing a sign of depression. You see, and let's see the core components of bipolar 2. Bipolar 2, we have said, is low. It's not high energy, elevated, expansive or irritable mood. A period of elevated, expansive, irritable mood, increased activity or energy, lasting at least 4 consecutive days. At least 4 consecutive days of having this episode. And a minute, guys, let me see this. So this one is called hypomania. You have the energy, but not so high energy like the other one, the normal hypermania that you usually have. Here you have increased confidence, reduced need to sleep, increased talkativeness, racing thoughts, increased productivity as a normal person, but you will notice it is not normal like this person always have the high energy, mild impulsive behavior. The impulsiveness goes down. You see now where people confuse bipolar with ADHD. You see, this is where people confuse bipolar with ADHD, because in hypomania you have mild impulsive behavior, increased sociability, and you're trying to behave like normal person. You are trying to behave like a normal person. You see, unlike mania, hypomania does not cause severe functional impairment. Psychosis is absent. Here you don't have features of psychosis like hallucinations, and being delusional. In hypomania, this is bipolar 2. You are always okay, but people may notice some depression or reduced activities in some places. This one we don't hospitalize. We give cognitive therapy and we tell the relatives to watch out on how these people are going on. We have major depressive disorder in bipolar 2. Major depressive disorder, where you get some this person is sad, fatigue, poor concentration. When you are undergoing these complications, a person always thinks about it. Why am I like this? And this person may not tell you. He may not tell you that he's thinking. And that's why in hypomania, bipolar 2, we always see that these people are depressed, suicidal thoughts. You get hopelessness. Sometimes they are hopelessness. They have hopelessness, because they are trying to think, why am I behaving like this? And it's a genetic thing. So you are only given drugs that are mood stabilizers like lithium, serotonin inhibitors like fluoxetine, drugs like those ones. So this is bipolar 2, and we have seen it is the opposite of bipolar 1. Bipolar 1 is real aggressiveness, real disturbance. Hallucinations come in. Sometimes people have delusions. You get some part of psychosis. Sometimes bipolar 1 needs admission. Sometimes it needs admission. Bipolar 2 is reduced activities. Interaction is kind of like normal, but you will notice the other features of overspending. Those that are hyposexual are still having it, but there is reduced aggressiveness in bipolar 2. But you will notice that these people have poor concentration, appetite changes, suicidal thoughts, and hopelessness. They are always thinking, why am I like this? Why am I like this? Let's get to know the real difference between hypomania and mania. In hypomania, it is mild and moderate aggressiveness. Mania is real aggressiveness plus some hallucinations plus being delusional. Duration might be in hypomania. Hypomania, I've said, when you hear bipolar 2, just know that is hypomania. Less than 4 days or equal to 4 days. And then mania goes up to 7 days or equal to 7 days. That's why we do what? We admit them. That's why we admit them. It may burst out to be, a person who has hallucinations and delusions. This person can injure himself, herself, or someone else. So it is very good when this person is under monitoring. So if you find someone is bipolar and has hallucinations, this person is delusional, and you always know this person is bipolar, you should immediately restrict this person from the social community or take this person to admission, because this person may be a social hazard. And when this person comes normal, he will not know what he did, because it was a session of bipolar with psychosis. So it's good to admit them. Psychosis. In hypomania, psychosis is absent. Bipolar 2, psychosis is absent. But in mania, that is where we get psychosis. If it goes so high, we'll get psychosis. And hospitalization, I've said, we don't admit in hypomania. We monitor and give some drugs to tone down. But in bipolar 1, which is real mania, we admit. It's very important to admit or to be under watch out or lockdown. Hypomania, functional bipolar disability is mild, but in mania it is marked. Let's say bipolar 2 and bipolar 1. You've seen there is a difference in some things. So 2 is a bit better than 1. And we are still using the same neurochemical neurotransmitters: dopamine, serotonin, norepinephrine, and glutamate. So a person who is hypomania, that one norepinephrine may be high, and dopamine a bit normal, but So if you have a question, let me know. Anyone who has a question, that was bipolar 1 and 2. We still have bipolar 3. Bipolar 3. Any new person in the house? If you are a new person in the house, welcome, and we like you, we love you. Ask us any question. Ask us any question that we may ask and we may interact with. We have another type of bipolar that is called cyclothymic bipolar. Cyclothymic disorder. Chronic fluctuation moods for 2 years or more than 2 years. Cyclothymic. That is another thing that is called bipolar. Cyclothymic. It can go up to 2 years or more than 2 years. Today people are listening so slowly. If you have a question, ask. We know where to chip in, or people are taking notes. People are taking notes. Now, cyclothymic disorders is another type of bipolar, and it takes some time. It goes up to 2 years. Chronic fluctuation of moods, mild hypomania symptoms, plus mild depressive syndromes, does not mean full criteria for mania or major depression. You see, there is a person who at times, that one was coming from the coffee cakes. Coffee cake said something. Let me get it. Let me see if I can get it. Let me see. Coffee cake said, could that not be only one time, temporary insanity? This is where now we are. This is where now we are. We are at cyclothermic. That one is what is categorizing into temporal insanity, cyclothermic disorders. Cyclothermic disorders, you may think this person is normal, or sometimes he has bad features. But this is whereby people say that person has just bad character. No, it is not bad character. He is a person with bipolar. Masitai in the house. Masi, welcome to the house. Blessings. I can see you and your sister Ina. Even Masi is a calm lady. Masi, you are just calm like your sister. You don't talk a lot. Yes, welcome to the chat. Now, cyclothermic disorder is chronic mood disorder characterized by recurrent hypomania, recurrent periods of depression, and symptoms that do not fully characterize major depressive disorder, full hypomania episode, or manic episode. You get? Depression. We need to talk about depression too. Depression is another thing that is really not, people don't know how to categorize depression. When you are thinking a lot because of an acute thing, people think that is depression. But depression comes with the diagnosis of very specific issues. And things. You get? So, in cyclothermic, someone is normal, having these features of hypomania, that the ones that I've named. You may find a person with frequent mood swings, emotional ups and downs, emotions that are up and down, fluctuating energy. Sometimes this person is down, he's not feeling like talking, he's not feeling like is in moods. You get? Sometimes this person is energetic, very high energetic. So when you find sometimes a person is very aggressive, not aggressive, very lively, high energetic, and then you go one day you find this person is down, doesn't want to talk. It's like one person with two different characters. You will now understand this is called, or have you ever, is anyone in the group ever met someone like that? This is called cyclothermic characteristics. Cyclothermic, whereby one person has two different characters. You meet a person today, it's very down, not having many issues, but you meet a person the other day, this person is having issues. He can talk to you and he doesn't want you to go, but the other characteristics are still there. You check. Have you ever met someone like that one? Guys, my friends in the house, if you have ever met, you know what I understand. Some people say that, let me check this out. Some people say that that person has two sides of him. Today that person is down, tomorrow that person is. You cannot tell that this person is this one. Or have you ever met a boss where you are working? He'll call you in the office, talk to you in a very nice way. You are okay, the mood is fine, but wait a bit, wait again, hey, the next time you will like it. He'll call you in that office, you will not like it. These are the people that we call cyclothermic behavior. And what are their characteristics? Cyclothermic, but you see they are under bipolar. I've said bipolar 1 has hypermania, aggressive behavior. Bipolar 2 has hypomania, reduced activity with some depression. And we have the third one, which is cyclothermic behavior. Cyclothermic behavior, depression and low hypomania, activities, reduced activities. You see, key characteristics in these are frequent mood swings, emotional flare-ups, and fluctuating energy and motivations. And we should get to understand how to categorize, so that we don't confuse bipolar 1 and 2. We don't confuse bipolar 1 and 2. You get? We don't confuse these two. Bipolar 1, hypermania. Bipolar 2, hypomania. Cyclothermic comes in this way. Symptoms must be first at least 2 years in adults. Adults must have a symptoms of at least 2 years. At least 1 year in children and adolescents. But in adults, you must have 2 years. During this period, you should have present at least half symptoms present at least half the time. So if you calculate the presence of the symptoms, at least they come 6 months of these symptoms. A person who is under depression for like 6 months in a year. Hypomania for like 6 months. So if you have checked this patient for 2 years, at least depression of 1 year. If you calculate the time, there is a way it is calculated. So mood states in cyclothermic. How is mood states in cyclothermic? Cyclothermic has increased energy. You have a lot of energy. Increased confidence, increased talkativeness, sociability, but mild impulsivity. You talk a lot, but you don't talk without thinking. You don't budge into things. You don't do things without faster. You know, impulse buying, doing things impulsively, it's not there. But when it is coming to talking, you are talkative. When it comes to sleep, you don't have sleep. When it comes to energy, you have a lot of energy. And when it comes to activity, you do things with a lot of activityness. You get? So let's talk of depressive symptoms. But check this out. Symptoms are less intense. Functioning is usually preserved. You live like normal, but symptoms are less depressed. What about depressive symptoms? What about depressive symptoms? Just a minute. Something. Don't go away. I'm still here. Yes, I'm back. I was answering an important call. And now we were talking about the cyclothermic behavior. That is bipolar 2. So in bipolar 2, with the depression that you get, you see low moods, fatigue, and reduced motivation, poor sleep concentration, and low self-esteem. These people have low self-esteem because you have a condition that you don't understand. When you get a condition that you don't understand, you start having problems by yourself. Problems by yourself in that you start having depression. Sometimes when you are undergoing something that you don't understand, you will start having depressions by yourself, undergoing problems that you yourself you don't understand. So self-esteem, because you feel that you are not like the other ones. Poor concentration. and reduced motivation and fatigue, low mood. This is there when you have cyclothermic behavior. Bipolar disorder 3. Bipolar disorder 3. And what is there? What brings these bipolar disorders? What brings this mood concentration and mood fluctuation when it comes to bipolar? The main neurotransmitters, when you feel anything, anytime you come across any problem that involves the brain, be it neurodevelopment like autism, be it ADHD, or mood disorders like ADHD. We have other mood disorders. We have other mood disorders. Always think of neurotransmitters. Neurotransmitters are the most common when it comes to mood changes. When you are down, when you are thinking you can vibe, when you are thinking you can think of the neurotransmitters. And the neurotransmitters are what? Chemicals that pass message in your brain to the nerves. Those chemicals that pass signals and message. And which chemicals are these? Dopamine, serotonin, and norepinephrine. I've always talked about this. Neurotransmitter involvement, mood instability. When you are down and you are not feeling to be compensated, you are not feeling like you want to be with others, think about dopamine. Remember when we talked? Yes, it was yesterday or when? A day before. We talked about this dopamine, we talked about this serotonin, what they do. Dopamine is a neurotransmitter that is it comes to the system or induced from the prefrontal cortex of your brain when feeling of pleasure comes in, compensation and motivation. Pleasure, compensation, motivation. You get? You remove dopamine, so it makes you feel good. Serotonin when you want to learn some things. Serotonin, like bike riding, the memory. You remember when we talked about the memory, how you store some things. So serotonin is there to keep this up so that you remember. If you don't have this dopamine, serotonin, and norepinephrine, this is where people now becomes forgetful. And let me tell you one thing. Have you ever met someone that people say that one has no feelings? That person, even if you do what, even if you want to make that person laugh, you will never. That person has no feelings. You should think about the neurotransmitters from the brain. Some people, it's not their problem. You want to love people in and out, and their dopamine receptors have a problem. The neurotransmitter dopamine has a problem. They don't feel the love that you are showing them because they don't have the pleasure receptors that are working, or they don't have the neurotransmitter that is enough. So as much as you are trying to make these people feel loved, as much as you want to make this person feel compensated, as much you want, this person will not, because now the neurotransmitter or the receptors of the nerves that are receiving dopamine, they are destroyed. So you are doing some things and this person is looking at you at like, so have you ever come across a person that has loved someone so much, and then one day you talk to the other person and that other person tells you, I don't even understand why this person is doing all these things for me. This one always, most of them, it comes to a high percentage is in ladies. You may find that these people are undergoing cyclothermic periods. The neurotransmitters have impaired, the receptors are impaired. You see? So There are some brain structures like the limbic system, amygdala just down before the pituitary gland that helps, prefrontal cortex that removes the dopamine. These regions regulate mood, emotions, and response, impulse control. I see, my guys, you now know why people, some other people, you call some, you say that some other people are heartless. They do things without thinking. Hey, sis, welcome. Now, when you hear someone talking about that person is heartless, I just did something at work, and I'm giving an example. A person says, I depend on this work, but I went to him and I said I was just late at work because of, and this person had no any sympathy. He just chased me away and told me to go. Some people are like that because their mental stability is not okay. When they are given, this is your rules to make this work go on, or this company go on, they will follow the rules as per they are. Sometimes people will have that human heart. Let's say a mother who is breastfeeding and is late at work, or a mother who has kids and has taken her kids to school and is late at work. You as the leader or the manager, you may kind of like say it's okay, but get some way you cannot be getting late to work. So you get a manager who has a problem with prefrontal cortex and the amygdala. Hey, a person who has a problem with reduced dopamine. You late the first day, the second day, this person will tell you, please, this is not your work. Go home. I don't want to see you here. Some things, when you say that that person is not human, it is not that it is their liking. It is how they were brought. And a person with cyclothymic behavior, you cannot know when this person is coming to interviews. He may be composed very okay. When this person starts work, that's when you come and realize that we are dealing with a person who is cyclothymic, and already you have signed a contract. You see? So I know you are I know some people here are answering themselves the questions. Some people here are answering themselves some questions. Maybe you have ever met someone and you are always feeling that that person is not human. You do a simple mistake, you are out of work. You do a simple mistake, that person cannot think with you. You see? So if you have an experience out of this, tell me. I know some people here are answering themselves some questions. Mental health. Here we are talking about mental health, and that's why we are quiet. If you see people are quiet, they are answering themselves questions. Or am I wrong? Sometimes I can be wrong, but prove me right or wrong. These are things that are there in life. These are things that are there in life. We all have our experiences. We have worked several places. You have met these people. You have worked with them. You have gone to social groups, even in churches. You have worked with these people, and you have seen how the impulse comes in and how the emotions are. You have met people that are over controlling. Someone has told me some people are narcissists. Narcissism is another personality disorder. Let me categorize. That one reminds me about personality disorder. personality disorder with these complications, they are totally different. They are totally different. Let's categorize, we see, because you may not categorize personality disorder with complications like bipolar. Now let's see a person who has a personality disorder A, we have disorder B, cluster B, and we have cluster C. Those are personality disorders that we have, A, B, and C. Now, odd or eccentric behavior is for personality disorder 1. Schizoid, paranoid. You know schizoid? A person who a person who looks like is kind of like lack interest in relationships and emotional coldness. No, don't confuse personality disorder with emotional disorders and neurogenetic disorder. Let me go through them, but we will do personality disorder when time comes. Cluster A, they are paranoid. Personality disorder, persistent, disruptive, and suspicious of others. And then schizoid is those ones that have no interest in relationships. They like being alone. Social interest in relationship, and they always have emotional coldness. It's Chua. Welcome to the chat, it's Chua. And then we have schizotypal personality disorder. Schizotypal, odd beliefs, eccentric behaviors, difficult with close relationship. You are always having your beliefs that you have created for yourself. Eccentric behaviors. This is Lila Kahananui. Lina, hi. Leila Kahananui. Welcome. You are a new person. Where are you from? Lila, where are you from? Please tell us. Welcome. We have a friend in the name Lila. He's laughing. Lila is laughing at me. Yes, Lila. If you are new, Lila, subscribe and like. Subscribe and like. You get? Subscribe and you like. Now we have people that have cluster B, personality cluster B, who are dramatic, emotional, and erratic. Hey, you know them, last bones. People say cluster B is people from in a family. I'm not new, but don't mention my name. Okay, I won't. I will say our new friend. Welcome to the channel, our new friend. We are talking about people that are personality disorder, B2M. Welcome, B2M. Our new friend. I'm from Alaska. I see. I remember. Lady from Alaska. Now, these people are antisocial. They have antisocial behaviors, borderline personality disorders, and histrionic personality disorder, excessive emotionality and attention-seeking behavior. Histrionic. Oh, okay, Marwa's channel. Yes, I remember you, my new friend. Welcome to the channel. Hope you have subscribed and you are hitting the likes. Narcissist personality behavior. Someone asked for narcissist, and I say narcissism is a personality behavior. It's not a complication. So, if you are a narcissist, just know you are a cluster B. If you are histrionic is a person who is excessively emotional and attention seekers. There are those people who are always seeking attention, And then we have borderline personality. Instability in relationship, self-image and emotions are high. Disregard antisocial, those people that are antisocial. Cluster B. Let's talk about cluster C. Cluster C. You have met these people. People always say that last bonds in families are cluster B. Yeah. Let's talk about what personality are you? Tell us where you are. Let's see. You that you are watching, Benjamin the Wise Guy, what cluster are you? Tell us. Cluster. We have said that cluster A is paranoid personality disorder. Persistent, destructive, and suspicious of others. Schizoid or personality disorder is lack of interest in social relationships, emotional coldness. But we have another one which is schizotypal, odd beliefs, eccentric, discomfort with close relationship, very discomfort with close relationship. Let's check on cluster B, who are dramatic, emotional, and erratic. They are antisocial, disregard the you get borderline personality, instability in relationships, self-image and emotions. And we have histrionic personality, excessive emotionality, and attention seeker. So when you hear about histrionic, just know it's excessive personality. And narcissism. Narcissists are cluster B. Grandiosity, need for admiration, lack of empathy. Narcissists are these ones. Let's talk of C. C are those people that have avoidant personality, extreme sensitive to criticism, and social inhibition. When you are criticized, if you are in Kenya, you already know who has this cluster C. If you are criticized, you can bring the whole town down. Avoidant personality disorder. People in cluster C have avoidant personality disorder. Extreme sensitive to criticism and social inhibition. If you are in Kenya, you know one person who has that. I don't want to say dependent personality disorder. Strong need to be taken care of. Difficulty in making decisions alone. You have to talk to the other people so that you come with an amicable point to make decisions. This is dependent personality. And then we have obsessive compulsive personality disorder. Preoccupation with orderliness, perfectionism, and control, different from obsessive compulsive disorder. You want to be perfect with orderliness, no messing around. You should be clean. Your words should come out that are very perfect, no messing around with anything. Control. You have to tell people that this one is, it should be looking like this. When I come to my office, I left my earpods here and my pen here. Why have I found this here and my pen is here? This is called obsessive compulsive personality disorder. So let's see. Where are you lying? My sister Maggie. Maggie is here, Maggie on my phone. Your sister you can joke with anytime. That's why I joke with Maggie. Maggie, which personality are you? Perfectionism, obsessive compulsive, cluster A, B, or C? Let's get people to tell us which clusters they are. Which personalities are you, my guys? Which personalities are you? Tell us which personalities are you, my friends. Tell us which Majay has said OCD. Majay is personality OCD. Preoccupation with orderliness, perfectionism, and controls. Yes. Majay lies under cluster C. Majay lies under cluster C. LCD. No. Anyone else? Let's see people. But when it comes to saying your personality, People always know their personality. When you talk of these things, people always know of their personality. They will always tell you I'm personality, this one or that one. People always know of their personality. So tell me guys, are you afraid of naming your personality? Or I repeat, I'm none. Oh, everyone has a personality, my new friend. Everyone has a personality. People are afraid of saying their personality. We have those are personality disorders. Now let's talk about now. Imagine you don't have OCD. Those are disorders. Let me name types of personality now. Types of personality. Those are disorders. But you know, OCD maybe it's a good type of complication. Because if you are my new friend, those who are disorders. Now I want to name the real personalities, the normal ones. Type A, B, C, D. Type A, B, C, and D personalities. Type A people, I want you to listen. These are normal personalities. Now we are not in complications. I started with complications to jack up type A personality. Type A personality, one, they are competitive, ambitious, time conscious, impatient, and high stress levels. Competitive, ambitious, time conscious, impatient, and always have high stress levels. Those are people with personality A, often associated with high achievement and stress related illness risks like hypertension, stress, depression. People with personality A, they are always having diabetes, hypertension, because you are competitive, ambitious, time conscious, impatient, high stress levels. And you know, high stress levels releases cortisol, which gives some problems. So let's see, type of personality B. These are normal personalities. Personality B are people that are relaxed, patient, easygoing. They are people easygoing. You get less stressed. These are people, they are not stressed. They are heading a company, they are heading a facility, they are heading a farm. Even if you do what, they look at you and say all will be well. Creative and flexible. They are always flexible. Usually calmer and less competitive. You see, these are people that are easygoing. No problem. We are just there. At least these are now the other ones who are complications. These ones are now personalities. You get it? It's sure. It's sure. It's sure. Did you get a little hint of whom I am? Yes, you get. So these are type B personality, people that are easygoing. So personality A, these are serious people with life. They don't want to joke around with life. You get? These ones are people that don't like to joke around with life. Now let's take about type D personality. Type D personality. Distressed personality, people with distress always. Negative emotions, social inhibition, and worry and pessimism associated with anxiety and cardiovascular stress. So it's sure. Tell me about your personality. Where do you lie between A, B, C, and D? Now these ones are these ones are the normal one. The other ones were complications. Always, let me repeat. A, they are competitive, ambitious, time conscious, impatient, and high stress levels. B, you are always relaxed, patient, easygoing, less stressed, with creative flexibility. You don't have stress, you don't love stress. You get it? You get? Now, type D. Type D. Type D is distressed personality, negative emotions, social inhibitions, and worry and pessimism. You are always anxious and you are stressed. But we have these other people. We have introverts, extroverts, and ambiverts. Now, an introvert is a person who gains energy from being alone. When you are alone, you think a lot and you do things very clearly. Quiet and reflective, prefer smaller groups than big groups. But extroverts gains energy from social interactions. Those people that are very social, outgoing and expressive. You are always expressing yourself. You have the power to interact. Enjoys group activities. You are always enjoying group activities. But we have ambiverts. This one mix of introvert and extroverts. At times you want to be alone. At times you want to be out there socializing and being. This easygoing one, Dr. Benjamin. Uncle is saying personality of Uncle is B. Personality B. Easygoing, no pressure. Uncle says relaxed, patient, less stressed, creative and flexible. You see, that is Jamaican uncle for you, B. So we have another type that is introvert, extrovert, and ambivert. So me and you are the same. My new friend and Jamaican uncle are the same. They are category B. Who is saying is no one is saying is category A. No one is saying is category A, where we have competitive, ambitious, time conscious, impatient, and high levels of stress. No one. We don't want to meet. Please come on, guys. Who is category A? Where you want to achieve, time conscious, ambitious, you want to do big things with competitive. When you go to an interview, say, I can work under pressure. You can work under pressure. That's the type C. I'm very sure no one can say I'm type C. Who is type C? Let's see. Who is type C? I'm easygoing and very positive. Easygoing. So Mate has said this type C, type B. Type C is a funny one. Type C is passive, suppresses emotions, avoids conflicts, and cooperative and people pleasing. You see, let's see about type B. Type B, distressed personality, negative emotions, and social inhibition. We jump type C. So type C is passive, suppressive emotion, and avoid conflicts. So we have said about introvert and extrovert. Introverts and extroverts. Introverts, they want to do things alone. They are not social. Extroverts are very social. So when you find someone at times is an introvert, the easiest person and very positive minded. And who is a perfectionist? We don't have people that are who are watching. If you are watching, we don't have a perfectionist. Tell us if you have a perfectionist, guys. Tell us if there is a perfectionist here. Who is a perfectionist? Let's see who is a perfectionist. Let's see. Ambivert. Who is an ambivert? Mixed of introvert and extrovert. Who is an ambivert? Sometimes you are social, sometimes you want to be alone. And when you are relax, I was giving you a hint. It's T, but don't use T. Let's not use T. Don't use T. I was saying T, not our new friend. I want to tell people something about this one. Let me give you a hint of giving the big 5 personality trait. You write ocean. You like ocean. So the first ocean, this is ocean. The first one is openness. Openness, creative openness. Here is openness, creativity, curiosity, and imagination. So when you are open, you want to imagine and do things creatively, you get. And then we have conscientiousness. Consciousness or conscientiousness. Organization, discipline, and responsibility. Openness, creativity, curiosity, and imagination. Or I write with red so that we don't forget. These are the type of big 5 models of openness. Is creativity, curiosity, and responsibility, and imagination. Organization, display, and responsibility. Anyone who has a question, my friends? Openness, curiosity, imagination, and curiosity. Conscientiousness, and organization, discipline, and responsibility. And then we have extraversion. You go beyond. Extraversion. Social. You have the social breakdown, and energy. Social and energy. And you have energy. Openness, conscientiousness, and extraversion. And then we have agreeableness. You agree. Kindness, empathy, and cooperation. So when you are agreeableness, you are kind, cooperative, and empathy. Extraversion is sociability and energy. So we have these that are these ones are the big 5 personality traits, the ones that people like. You get And then the last one is neuroticism. Neuroticism, emotional instability, anxiety, and mood swings. So these ones are it. The big five. You just say ocean. So the first one is openness. A person who has creativity, curiosity, and imagination. Conscientiousness. You can say conscience. Alimig, what is my comment not going through? Maybe you have a problem with networks at MIG because others are coming in. Maybe it's your network. Sometimes when you have network problem, you'll have problems in posting. Now, consciousness is a person who is organizational discipline and responsibility focused, extraversion, social and energetic. And then we have agreeableness, kindness, empathy, and cooperation. And then we have neuroticism, emotional instability, anxiety, and mood swings. So, my guys, these ones are the big five of personality traits: openness, consciousness, extraversion, agreeableness, and neuroticism. Ocean. So if you write ocean, you have the good characters that the people need. Today people are not asking questions; they are listening to their Alimig, check your internet, because everything is okay by here. Maybe you have internet issues where you are. You see? So there are 16 personality types in total. When we will be talking, well, now they are coming. When we will be talking about personality traits, we will talk about 16. We were talking about bipolar disorders, and I came to talk about personality traits so that you cannot confuse with bipolar disorders when we reached at cyclothymic disorder. So that is it for bipolar. Who has any question concerning bipolar disorders, my friends? Who has any questions? Who has any question? The brain structures that are involved in bipolar disorders are limbic system, amygdala, prefrontal cortex, and the regulations are mood, emotions, and impulse. There is somewhere where I talked about amygdala, and I think I'll put that video once again so that people can learn. When I'm saying amygdala, it's a part of your brain just above the just below the brain, where the pons are starting going down. You see? So anyone with a question about categories of bipolar? Anyone with a question about categories of bipolar? Anyone who has a question, or you can add something. Diagnosis, clinical. Tomorrow we will deal with how to diagnose and differential diagnosis, if I will have some time, because tomorrow my schedule might be confusing, tomorrow and Thursday. So anyone who has a question or can add something on what we have said, you are welcome. Anyone who is confused and is not knowing what we are doing or what we have talked about. We have talked about so many things. And I thank everyone that has been here. But before I go, please, if you have a question as I'm relieving myself, put it so that as I come, we can talk about it. You can text on the chat. Let me help myself in the washrooms. I come. Yes, guys, I'm back. Sorry for waiting for too long. Now, there is no question. I'd gone to check, and I can see now people have not given any question. Anyone who has a question, greetings, Stan's Kitchens. Greetings. Is the liver over or Dr. Benjamin is busy? The live. We are just Stan's Kitchen. You are just ending the live, and I had rushed to pick someone. There's something and relieve myself. Bosire is in the an extrovert. I strive under pressure. Queen is an extrovert. People are afraid of saying about their personalities. Queen is an extrovert. Who else? Who is an introvert? Now, how many? Oh, I have 4 minutes. To go, my friends. 4 minutes. Who else? I know you are a very busy person. Yes. At times I can be busy. At times I can be busy. At times I can be easy. So, anyone who can share about their personality. Anyone who can share about their personality. Today I talked about personality disorders, and I started by personality disorders, and then I went to personalities. So people became confused. So the personalities are not personality disorder. Yes, my friends. How many minutes remaining? 3 minutes. I used to be an introvert, but I'm the opposite now. Sometimes when you be an introvert, persistently being an introvert, and things are not going on how you want, it changes you automatically to be an extrovert. Social, being everywhere, you get energy from other people, socializing, and you live well. I know people know me right now. If you are watching, tell me my personality. What do you think is Dr. Ben's personality? We have 3 minutes. Tell me my personality. Who knows my personality? If you know my personality, please tell me. If you know my personality, please tell me my personality. Anyone? We have 2 minutes to go. My personality. Who knows my personality? Tell me my personality if you can guess my personality. Anyone who can guess my personality? 2 minutes to go. Who knows my personality? No one can guess my personality. Guess my personality, guys. Any of you can guess my personality. Any of you guess my personality traits. You have the good one, Doctor. The ocean. Ocean is type of personality. So openness, conscientiousness. You remember? Ocean, neuroticism. Ocean, agreeable, extraversion. Someone who opens his hands to the world. I'm an extrovert. Dr. Ben is an extrovert who has ocean. When I say this kind of personality, it's called openness, consciousness, extraversion, agreeable, and you get. Now, me, maybe I'm an extrovert. Maybe, I don't know. I'm just me. 1 minute to go. 1 minute to go. Guess the type of personality, please. Anyone type of personality? Let me check out this one. Let me check out Lila and Stan's Kitchen. Type of personality of guess. Let me pin it. Guess my type. But you know that one was not the topic of the day. The topic of the day was bipolar classification. But the topic of the day was classification. So it came out because we didn't want to confuse classification by personalities with complications. Bipolar is a complication, but we still have bipolar disorders that we named. Even Majay confused and he said he has OCD because I wanted to play around with some tic-tacs. Yes. So guys, you can be an introvert depending on your environment. Yes, my internet no good, guys. No worries. It is when it is raining, there is problems everywhere of internet connection. So we have categorized all these things, and guys, I will be answering your questions after 3 hours from now. So let me see who has guessed right. Here. Let me see that one. So thank you for dropping in. And sometimes I feel nice. You know, just like we have talked, we have 120 people that have been watching, and some don't want to chat, they are afraid. So those that watched and those that have been on the background, thank you so much, and may you be blessed. At 9 I'll hold a short session as usual. If you can be there, please come. I'll be on Jamaican Uncle's premiere there. Today I've not seen Xavier Man. I'll text Xavier Man. Maybe he's busy at work. Even my big sister Sham, maybe she's busy somewhere at work. So be blessed, my guys. Be blessed. The Jamaican Uncle, I sometimes lose your chat on your show, and I feel frustrated. Yes, Jamaican Uncle will be premiering Stan's Kitchen. Jamaican Uncle will be premiering how many minutes? 27 minutes from now. So just count 27 minutes from now, you'll be seeing Jamaican Uncle premiering. You see, I'm kind of like confused on saying premiere. So good people, blessings. Bye. See you the other time.